me to talk specifically about this particular trial,
Great.
which is targeting the PAM pathway, right?
Thank you.
But not necessarily. This agent appears to work whether you have the pathway or not. But
Okay.
so it works in pathway altered and pathway non-altered. So that's
Mm,
important to know, and they're trying to
yeah.
prove that in this clinical trial. But the Victoria One trial, and this is a very important trial that we're doing across the world and in the US as well. The Victoria One trial. It's a clinical trial for patients whose cancer has progressed. They have estrogen receptor positive breast cancer, HER2 new negative breast cancer, and their cancer has progressed on the standard first line therapy that I talked to you about, the aromatase inhibitors and the CDK4 inhibitors. So it's a trial looking specifically for patients who need second line therapy. Their first line therapy has stopped working.
And
And the
those first line therapies could be Ibrance, Kisqali, Verzenio.
Yes, so all the CDK4 inhibitors, those
Okay,
three
great.
you mentioned,
If you're
absolutely.
taking any of those and your cancer's progressing, this is a great thing to.
Yes. So if your cancer is progressing on these standard therapies, you can go on to standard of care. So standard of care with if you have no mutations, your oncologist looks for mutations, you have no mutations. Right now, the standard of care is to switch to the fulvestrant, the injection I talked to you
Got
about,
it.
a
Got it.
super anti-estrogen, a SERD, right? That's
Should
the
you
stand.
rebiopsy before that?
Yeah, I think it's very reasonable to rebiopsy or at least do the liquid biopsy where you look in the patient's blood to look for any mutations. One or both should be done. Yes. And so the standard of care would be to switch to fulvestrant. That's what your doctor would offer you.
Yeah.
Now,
Yeah.
there's some new data where your doctor may offer you fulvestrant plus add the cyclin-dependent kinase inhibitors anyway, even though you've had them once before. So that's possible as well.